Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. And I'm so happy to have our guest, Dr. Stephanie Wolf-Rosenblum, join us today. Stephanie is a longtime resident of Nashua, or I should say Dr. Rosenblum is a longtime resident of Nashua, a longtime physician in Nashua. We go way back in full disclosure. Stephanie's the reason I'm here, so that's why I keep reverting to the Stephanie versus Dr. Rosenblum. Please forgive me.
Oh, please.
So at any rate, welcome.
Thank you. Thank you for having me today.
We have you here really as a member of our Board of Health. You're wearing a different hat these days. But before we get started on all of that information, it would be great if we could just do a little COVID update. That's kind of the way we've kind of had to start all of our shows recently. So I'll let you do the global and the U.S. update, if you don't mind.
So to date, there have been 113.4 million cases globally and 2.5 million deaths. In the United States, there have been 28 million cases of COVID-19, and we just surpassed 500,000 deaths.
Yeah, so that was a milestone, a very unfortunate milestone.
Yes.
That was observed this past week. And again, our sympathies really go out to those families who are really suffering a loss of a loved one and their friends.
The families, the communities, every loss of life has ripple effects.
Yeah, so it's really been quite a year. We're really coming up to a year in this pandemic. Not quite there, a few more days. So we'll move on to the state of New Hampshire. We have a little bit better news in New Hampshire. We've had 353 cases for the past week on average. An average of 317 cases per day. And we have a 4.1% 7-day positivity rate, and that's just an average. So we're finally below the 5%, which puts us at just regular transmission, not substantial. And that's good news. Hopefully that trend will keep going. And we're really hopeful, again, that, New Hampshire's a little bit different. New Hampshire runs a little lower than the city of Nashua. So looking at the city of Nashua cases to date, we have 6,388. We have 182 active cases as of today. This is very fresh data. Our new infections per 100,000 are 349.1, and our 7-day total test positivity rate is 5.6%. So running just above that 5%. So we're still, our level of community transmission is still considered substantial. So even though that percentage that we show on this graphic is yellow, we are still, we still have that red because we are over 100 cases per 100,000 in the community of Nashua, in the city itself. Our next graphic is an interesting graph. As you can see, if you look at the far right, we are definitely trending down. And really the last 4 weeks, we've been trending down, which is really positive. We're not out of the woods yet. So we just do like to remind people to continue to take precautions. And for those of you at home, you can't see this, but Dr. Rosenblum is wearing a double mask. And you've chosen to do that for several reasons. Do you want to explain why you do that now?
Well, there's no question about the science, Jane. Mm-hmm. The science is that masks work. Mm-hmm. And they work by making sure that whatever virus or germs are in my breathing passages don't get out to you or people that I'm around, but also that the viruses that are in the air, we know that COVID-19 hangs in the air in what we call an aerosol, that I would not breathe that in. Now the effectiveness is dependent on how strong the mask is and how well it fits. And since people's faces are different shapes and the masks fit differently, what they say is that doubling up on the masks makes sure that it's a good fit and a better seal that reduces the likelihood that I would either get people sick if I had COVID-19 or that I would get sick if people around me had COVID-19.
Okay, so it's a really good precaution to take.
It is a
I mean,
good precaution.
You know, obviously we're still in 100% mask wearing. Nothing's changed. The double mask. So I've noticed too, sometimes I'll put on like a surgical mask, you know, one that I bought at Costco or wherever, and my sides are open.
Yes.
Because of the shape of my face. So
yes.
When I'm at clinics and I'm helping out in the community, I also double mask. I wear my surgical mask first, and then I put my public health mask on over. But I really do notice the difference. And I feel really secure when I do that. I mean, it's just an unusual feeling, but it makes me feel more confident.
It's a way that every person can help participate in a community effort to protect each other. And so it is a feel-good thing, both for the individual feeling more safe, but also in terms of helping community and friends and family.
Right, right. So keep wearing those masks is our message.
Masks.
And we're very repetitive on the show, so we'll probably be saying that again. But so moving on to our next graphic, kind of want to, even though we had a hard week hitting 500,000 deaths, in New Hampshire, our state is looking much healthier. And that's really good news for us. And we have to have some good news mixed in with some of this, you know, unfortunate news. And so if we look at this, we have a county level map, we have the public health regions, and we have a town map. And what we see is we see Grafton and Stratford County still very dark. Those are the darker areas have higher rates of transmission. And I was scratching my head thinking, why is this happening? And then I realized those are where the colleges are. And they have had a spike in cases. So I do believe that is affecting this map. And hopefully that will be under control soon. I know UNH did just start in-person classes again this past week, but hopefully they do have this under control. And then you can see by town, happily, Nashua is not dark in the third map on the right. So that's really good news for us.
You know, Jane, it is great news. But as I'm sure we'll speak about, it's not the time to let up on our precautions for many, many reasons.
Yeah, absolutely. Yeah, and we will talk about that because that's what we talk about every week.
Important.
Yeah, so just looking at the next thing we just do a little equation for everyone so they understand what percent positivity means. And this week we have a 7-day average. We have 19 positive cases on average per day. We're running about 349 tests per day in the city of Nashua. So that gives us a 5.4% positive test rate, one we've already talked about, but I like people to understand how we arrive at those numbers. It's not voodoo math. So just, if you can help us just review, we talk about when to get a COVID test. So we're still, even though we're in a vaccination stage, COVID is still being transmitted throughout the community. And so we want to remind people when it's important to get that COVID test.
So one of the things that people want to do when they believe they've been exposed to COVID, or they've been traveling and they want to see what level of precautions they want to take, they want to get the COVID test right away. Mm-hmm. But the problem is that if you take it right away, it could be a false sense of security. Mm-hmm. What they say that the best time to take it is between 5 to 7 days, because that's when most of the virus will show up. You may not feel it, you may be asymptomatic. Mm-hmm. You may remain asymptomatic the whole time, but then you would know that you're at risk of spreading it to others that you might be in close contact mm-hmm. with. During that period of time, you could also be what we call pre-symptomatic, which means you feel fine, but after another day or two, the virus symptoms may hit you. Mm-hmm. So that is the best time to get tested.
That's if you're traveling, for example.
Yes.
So because we do talk about that a lot in the state of New Hampshire. If you travel outside of New England,
yes.
you do want to stay home when you get back. You can have a COVID test. The state regulations right now are that after 7 days, you can, if you have a negative COVID test, you can end your quarantine.
Yes.
However, my theory is just stay home for 10 days. Because testing is more reliable than it was as far as turnaround time. But if you're going to test on day 7, you might not have your results till day 9.
That's right.
in courtesy to your friends and neighbors, stay home if you've traveled outside of New England. Other reasons to get tested is if you develop symptoms of COVID-19, loss of taste and smell, which is a very specific symptom and one that we see a lot when we're doing disease investigation. We hear about it all the time. And that seems to be one of the symptoms that people say something's not right because it's such an odd sensation.
You know what some people are doing, Jane, are actually getting, whether it's a scented candle or other smells that are strong, and checking every morning to see that their sense of smell is still intact, because this is one of the most common symptoms. It's very easy to detect, very more sensitive than, say, a fever. I know a lot of people track their fevers. And it's different than the kind of loss of smell you get when you have a regular cold and your nose is stuffy. In this case, your nose may not be stuffy, but you may lose your sense of smell and your sense of taste, which are very interrelated, and it's something that's very specific to COVID-19.
And we found that just kind of an interesting, if there can be something interesting in all of this, artifact of this, is that people are reporting it, constantly when I talk to clients and patients that have been diagnosed with COVID. So also cough, shortness of breath, a fever, congestion, runny nose, nausea, vomiting, or if you've been exposed to a case of COVID-19, to a positive case. And that's exactly what you just said, Dr. Rosenblum. Wait 5 days, at least 5 to 7 days after that exposure. Because if you see your neighbor on a Friday and then you get a call on Saturday, don't rush out and get that test on Monday. You want to wait 5 days from that Saturday, at least, and then have your test. And you do want to do that quarantine.
You know, Jane, I'm glad you mentioned about the stomach symptoms, because a lot of people are very aware of the fact that this is very much a respiratory illness affecting the nose and the throat and the breathing. But some people only get stomach pain, diarrhea, and nausea, and they don't realize that it's COVID-19. So you have to pay attention to all the symptoms.
Yeah, and there's just a lot of them. There's a lot to pay attention to.
Yes.
And so we just try to realize, and I think that because so many people got the flu shot this year in a big push, and people are wearing the mask, people are really, if they're getting sick, it's an exposure.
Right.
It tends to be.
Lots of good hand washing.
Yes.
So a lot of kids, even if they're in a school environment, they're finding that they're not getting the, monthly, weekly colds that they were getting before because we're practicing better infection prevention.
We're doing things probably that we should have been doing before, the hand washing especially. I mean, obviously the mask wearing is new, but but the hand washing and, and not being on top of each other all the time, the 6 feet distance and stuff for kids, for example, in a school probably is preventing a lot of infections as well. So again, just to reiterate, if you're exposed to COVID-19, we want you to stay home and avoid contact with people outside of your household. Watch for symptoms, have that test 5 to 7 days after you had the close contact. Please do not go get tested in the emergency room. The clinics have freed up a little bit more. There are satellite clinics all around the city, and it's just uses resources that other people really need for true emergencies.
Well, the other thing is when you go to an emergency room, they're going to prioritize people with chest pain and, motor vehicle accidents. So you may wait a very long time to simply get tested, during which you could be exposed to other things. So very important that you also phone your doctor's office or phone resources first to see where you should go, because if you are possibly sick with the COVID-19 virus, you shouldn't just go to your doctor's office. You should get tested in an environment where you'll be safe and others around you will be safe.
Right, excellent point. And so, So I just do want to remind people that the Public Health Department does run a COVID-19 testing clinic every Tuesdays from 3 to 5 p.m. That's at 154 Daniel Webster Highway at the National Guard Armory. We do prefer that you have an appointment for that. You can make your appointment online. Just go to the division's website into the testing, under COVID-19 to the testing part, and there's a giant button there. You hit that and fill out the form. If you're unable and you have no internet access, you can call our COVID hotline at 589-3456. And again, that's every Tuesday from 3 to 5 p.m. So now that we've talked about COVID, we'll still talk about COVID, of course. Just tell me a little bit more about your background. You've been working, you are retired now, technically retired. I don't know, retired people
surprise, I went back to work. They needed my, so I am seeing patients.
Oh, okay.
But I came to Nashua in 1988 with a background and training in lung medicine, pulmonary medicine, critical care medicine, so seeing people in the ICU, doing a lot of ventilator work, and also doing sleep medicine. There's a lot of people out there that have serious problems with their sleep that can threaten their health, and more of them as the COVID-19 virus hits. But I did come here as a clinician and always expected to just stay behind my stethoscope. But over time, I am an organizer, and I saw that there were opportunities for improving the way that we delivered healthcare, so I became involved in medical leadership. And for a time, I was the medical director of what is now Foundation Medical Partners, which is a multi-specialty group practice. I was chief of staff of the hospital and chief medical officer at Southern New Hampshire Health. And now, as you pointed out, I'm a proud member of the Board of Health of Nashua, and I'm very excited to be in this position during this critical time in public health.
So I want to talk to you a little bit about the Board of Health. So let's just, who else serves on the Board of Health with you? If you could just give us a little background, because it is made up of several different clinicians and some aldermen as well.
Yes, well, we have Dr. Chuck Capetta, who's a pediatrician and a longtime consultant to the schools around sports and other important health matters. And we also have Dr. Tony Starace, who's a dentist by training. And we sit with members of the Public Health Department, and we're very proud and very appreciative that our aldermen take a tremendous interest with all the other things they have to be concerned about the health of our community. And together we discuss various aspects of how to keep the community healthy, not only when it comes to infections, but also when it comes to food safety and housing safety and safety of the environment.
Right. So when I looked up the charter of the Board of Health, you know, the traditional Board of Health, I'm just going to read a little bit of it. The Board of Health may take such rules and regulations related to plumbing, sanitation, and drainage of buildings, connection with public sewers, as in their judgment, the health and safety of the occupants or the public may require. So that's the traditional role. And then this is the more, they may also make such rules and regulations relating to the public health, as in their judgment, the public health and safety may require. So that bold section, what's bolded on my paper, is really where the Board of Health came in around the COVID-19 pandemic and really had to make some hard recommendations and very serious recommendations to the Board of Aldermen, who ultimately make the decisions whether or not. Way back, let's use the example of the mask mandate.
So this has been a very different time for Board of Health. We would meet, we would also discuss sewers, but we would meet monthly, and that would be sufficient to cover the work. Once the pandemic hit, we began meeting several times a month, sometimes more frequently, and bringing in a lot of other information and science. And the challenge has been that the information and the science coming out around COVID-19 is changing so rapidly that there's been a lot of misinformation in the community. And so it's been challenging to not only review the science and to make recommendations, to make sure those are accompanied by an explanation of why these recommendations are being made. And the mask mandate is a perfect example of that. So in the early days of the pandemic, our most recognized leaders said that masks were not going to be helpful. We didn't know. We thought it might be like other viruses where we were more worried about surfaces and hand washing. We didn't know about this part about the aerosols where it hangs in the air for up to 3 hours. And also there was a shortage of masks even for the healthcare workers. And so they didn't emphasize it because they weren't sure and because there wouldn't be a supply. Now we know it's very different. And we were very concerned about Nashua and making sure that our citizens were protected. And in the absence of a mask mandate for the state, we thought it was very important. It was our duty to recommend, and again, as you pointed out, it's the aldermen that make the decisions, but to recommend that masks be worn.
And that was not an easy pill to swallow for a lot of people.
No.
I think, thankfully, I think a lot of people are past that now, and it's just become a habit now for a lot of people. Although every now and then I do even run out of my car and think, oh, I have to turn right back around.
It's not easy.
Yeah.
I mean, I myself, you see, it's slipping down and I'm trying to adjust it. And, you know, you're feeling like you're not breathing, free air. Of course, my first area of expertise is lung medicine. I have a lot of people who have trouble breathing. And so asking them to wear masks is of concern. We had a lot of discussions in the beginning about athletes and asking athletes to wear masks while exercising and what would that do to their oxygen levels and their carbon dioxide levels. But we now know that mask wearing is not only safe, but keeps you safe.
Yeah, and even the athletes, I have a student athlete at home, and he dutifully wears his mask at practice, and they haven't had any games this year, but they do practice. And, it's not easy for them, but they do it. They can do it, and they can do it safely. And it keeps them safe, like they haven't had any infections on the team, and that's been really good.
It's really critical, and I think it's an important discussion now as much as ever, maybe even more than ever, because I know we're going to talk about vaccines, but vaccines, as far as we know, don't necessarily prevent you from carrying the virus and giving it to someone else. And the vaccines are not 100%. We're about to enter March. There's a lot of different activities in March. There's St. Patrick's Day, there's Easter, there's Passover coming up. There would be a lot of opportunities where people would ordinarily get together in crowded environments, and we need to make sure that people stay protected during this very critical period where not everybody's vaccinated and we can't really engage in a lot of outdoor activities. And so to keep ourselves safe and to keep these virus levels down and to continue this nice trend that you showed us, it's very important that mask wearing continue and that people continue to be aware of their surroundings.
Yep, and that's why I pop up on the screen the getting back to normal slide, because first of all, we're going to be getting back to a new normal. I don't know that we'll get back to the normal we're used to for quite a while, but we want people to, wear your mask, as you said, stay 6 feet apart from others, avoid crowds. It's still not time to have, like you said, the Easter gatherings or the Passover gatherings, or, we've all had to make sacrifices for the betterment of the community. Wash hands often, warm water, more than 20 seconds, sing happy birthday, do what you have to do, but do a good job doing that to keep yourself and your family safe.
Yes.
And then we get to the final thing, which is get vaccinated. And so there's a lot of hesitancy about getting vaccinated. And so if you could just speak to a little bit about the safety of the vaccine, maybe what your experience was, And because that stuff, right now in public health, in our own division, we're really trying to reach out to vulnerable populations. And some of these populations really are worried about the safety of the vaccine. So if someone asked you, is it safe? Is it going to make me sick? What would you say?
Well, I would first tell you that vaccines are going to be the single most important thing that is going to help us get back to that new normal. It is safe. It will not change your DNA. It's not made out of that material that would stay in your system. And what people are, and I've taken my first vaccine. I'm anxious to look forward to my second vaccine. So I think that's important that I'll, be out there and tell you that I gladly took mine. There was a lot of talk in the beginning about whether the vaccines would be rushed and that these are new vaccines and how could you possibly make a vaccine in such a short period of time. But the truth is that the technology to make these vaccines has been in development for decades. There were other coronaviruses and other types of viruses that also needed special new techniques to make vaccine. And it just so happens that all of that technology was waiting to be harnessed just as the COVID pandemic hit. And the vaccines have been tested now in hundreds of thousands of people. And people get local reactions, just like you do with a flu vaccine.
I had a sore arm.
I had a sore arm as well. And they say the second vaccine, people may get some fever and some additional symptoms, but those go away. And, when you get the virus itself, many people have symptoms for weeks and months, but the vaccines themselves do not contain active virus, and it is a well-tested and very safe way for your body to learn how to fight the COVID virus on its own.
Yeah, and some exciting news as I listened to the radio on the way over is that we have a third vaccine that is hopefully coming out soon. It is being looked at by the FDA for emergency authorization.
Yes.
That's from Johnson & Johnson, and that's a one-dose vaccine. And one thing we discussed at work this morning was that even though they're talking about the efficacy being a little bit lower at 66%, it's close to 100% effective when it comes to preventing serious illness and hospitalization.
And death.
So that is really, that's just huge. So that, COVID could maybe feel like a cold or something like that. And that's so important. So even though it is a slightly lower in efficacy, it's not slightly, it's quite a bit, but it's still going to prevent that serious illness and death, which I think is so important for people to understand.
So there's a couple of things that people should understand about this new Johnson & Johnson vaccine. And that is that it was tested at a time when we already had these variants. Viruses mutate very quickly. They change very quickly. That's why you need a different flu vaccine every year, because the flu is a little bit different. So it was tested later than these other vaccines, which were tested against the original virus. And now that they're testing those original vaccines, it's not quite the same either. The other thing is that now people are talking about boosters, and with any of the vaccines, and the Johnson & Johnson being developed as a single vaccine is incredible. Because not only does it mean that we can get to more populations and we only have to get to them once, but that vaccine is shelf stable for 2 years.
Right.
One of the challenges with the Pfizer, which was the first out of the gate and people the most familiar with, is that it needs to be stored on dry ice at minus 60 to minus 80 degrees.
Yeah.
And so just getting it, distributing it and keeping it safe and keeping it from deteriorating and being unusable is an insurmountable challenge for certain parts of the country, certain parts of the world, and if the whole world isn't safe, we're not safe.
Right.
And so the possibility of having a vaccine that can be at room temperature, that can be, just simply refrigerated.
Right. A world of difference, really.
It is a world of difference.
Yeah, because and part of the initial slower rollout,
yes,
I really believe is because of that storage issue.
Oh, absolutely.
And you really had to be ready to receive it. You had to have enough space for whatever they were going to ship you. I believe now they said it can stay in the fridge for 6 days. That was big news also on the radio today, once it's thawed. So that's a little bit of an improvement. But you really, it's like you have to manage your inventory, and it's complicated, and you don't want to waste any because this is gold right now.
Right.
So I do believe some of that logistical difficulty will go away with this.
And it's important, Jane, because look what's happened in Texas. And look what's happened with the distribution. You think you can get it into people's arms within 5 days, but things happen.
Right, real life gets in the way.
Real life gets in the way. And so the message should be, if you're offered a vaccine, any of the approved vaccines, take the vaccine. Be protected as much as you can. And over time, I do believe that we will find that there will be boosters and it will all even out. These are just 3 of the vaccines, but there are other vaccines being developed in other parts of the world. England has the AstraZeneca vaccine, and there initially were over 200 vaccines in development. So some of them didn't make it. These are the ones that made it. These are the ones that were proven to be safe and effective.
Yeah. So for a public health person and for a science person, these are very exciting times to watch this unfold. It really is historic. So the benefits of being vaccinated, again, we talked about that, avoiding severe illness and death, protecting yourself from COVID-19, protecting others. The vaccines work in your body's immune system.
Yes.
After 2 weeks of the second vaccine, currently, because that's what we have right now, your body will be ready to fight the virus if you are exposed. And we do encourage people, though, even though you have the vaccine, if you've had your 2 rounds, even if you had 1 round, you still need to keep your masks on.
Yes.
Because as you said, we're not sure if you still can transmit COVID-19.
So this is upsetting to a lot of people. They say, well, how long will we go on with this? But when we hit a certain percentage of people being vaccinated and people being safe and unable to transmit the vaccine, then we're looking to see that the vaccine will no longer be able to the virus will no longer be able to perpetuate itself. And then we can go back to, as you point out, a new normal, but at least get back to our lives.
Right. Right. And so I just want to remind people right now that who is eligible right now for the vaccine. So we are officially, the phases don't go away. So we are in 1A and 1B.
Yeah.
1A was primarily high-risk health workers. So those were your hospital staff and all those frontline employees.
Yes.
And office staff and those in medical offices, first responders, the ambulance drivers, the firemen, and the police. You can't underestimate how much contact they have with people daily.
Yes, that's true.
And then older adults living in residential care settings. So that's where we had some of the pharmacies coming in and vaccinating our long-term care facilities here in Nashua. And phase 1B is for people over 65, the medically vulnerable, at significantly higher risk. So if you have 2 or more comorbid conditions, and there's a very specific list, from what I can understand out in the community, people have been contacted by their primary care physicians and signed up, and their names have been given to VAMs, to the system, so they have been able to get their vaccination. Residents and staff of facilities for people with intellectual and developmental disabilities, corrections officers and staff working in correctional facilities, and of course we continue with our first responders and healthcare workers who have not been vaccinated yet. And I do want to address briefly, again, that public health has been holding equity clinics People say, well, why would you do that? Why are you, we want to, is that fair? Is that not fair? So one of the reasons we have equity clinics is that the most vulnerable populations that qualify for these equity clinics are also the most at risk for poor outcomes from COVID-19.
Yes.
So, and it's not to stereotype, but a lot of these communities live in multi-generational housing. They're essential workers. They're not taking off work. They're not able to do that. They're more likely to get sick. So we're giving these groups some priority, and the state has allocated 10% of its vaccine to these groups. So in Nashua, we've been really hard at work trying to reach some of these groups, whether it's at the soup kitchen or other agencies that serve people in transitional housing, and also just the BIPOC population, which is Black, Indigenous, and people of color, really trying to reach out to those communities and get them in to get vaccinated, because studies have shown on a national level, these communities are at higher risk for poor outcomes. So I just wanted to give that explanation a little bit today so people understand why we do what we do.
Whatever we do to protect the community protects all of us. And this is a wonderful effort that's being conducted by the Public Health Department. And people should have been contacted if they're in those high-risk categories. But if they think they are in a high-risk category and they have not been contacted, they should reach out to their caregivers, to their primary care providers. And also, if people have concerns, they can reach out to the Public Health Department. They can call 211, and they can get assistance in getting information, how to learn who's eligible for the vaccine and how to sign up for the vaccine.
And I also encourage people that call the health department. I just say, we need to be a little bit patient. And I know people's patience is running out.
Very hard today.
And I get it, because mine is too sometimes. Yeah. However, this is a huge undertaking, even in a small state, even in a small city.
Yes.
You think there's, 90 to 100,000 people in just Nashua proper, never mind Greater Nashua, and we serve the Greater Nashua region, the public health region. And so there are a lot of people that need to get vaccinated. And so, people, one thing the state has been doing, let people know that if you have an appointment, if you're over 65 and your appointment is in April or maybe May, they're trying to work backwards through that list and getting them, the state will be calling them and setting up an appointment at a satellite site. Right now that's at Walgreens. Whether or not they can increase that capacity at other offices or other pharmacies, that remains to be seen. But I always say, if you see the state of New Hampshire on your caller ID, answer the phone.
Yes.
So they're not, you're not in trouble. It's good news.
It's very good news.
And that also seems to be working. When I talk to people out in the community, talk to many, many people who've gotten that call and had their appointments rescheduled. Oh, we have so much to get in.
Yes.
But I thank you, Dr. Rosenblum, for spending this time with me.
Thank you so much for the opportunity.
It's been really nice to see you in person instead of on Zoom. And I wish you all the best of health and safety for you and your family.
And to you and yours.
Thank you. And take good care. And thank you for what you do on the Board of Health and in our community, helping us keep safe with your guidance. And I just want to remind folks that we do have a COVID-19 testing clinic every Tuesdays from 3 to 5 p.m., 154 Daniel Webster Highway at the National Guard Armory. It is a drive-through clinic. We do prefer that you have an appointment ahead of time. If you want to sign up online, go to the division's website, or you can call our hotline at 589-3456. In the meantime, everyone, stay safe out there.